Friends, we all know after crossing the age of 70, our body seems to enter a whole new world. At this stage, health checkups become our biggest source of reassurance. But did you know? Some checkups at this age can actually do more harm than good. Sounds unbelievable. Well, in today's video, I'll tell you about 5 important health checkups that, after 70, may sometimes put you at risk instead of helping you. Hello and welcome. This is your Seniors Healthy Tips channel. Here we talk about how to stay healthy as we age, the lifestyle of American seniors, and valuable information backed by medical advice. In today's discussion, we'll see which checkups can become risky after age 70, and why doctors sometimes stop recommending them. Remember, the information I'm sharing is based on medical research and general guidelines from American doctors. But the right decision about your own health should always be made in consultation with your personal physician. So, let's get started. Asterisk script colon cancer screening, colonoscopy. Why the risks are higher after 70 prostate cancer screening, PSA test. The problem of overdiagnosis mammogram, breast cancer screening. When it should be stopped cervical cancer screening, Pap smear. Why it's unnecessary after 70 routine whole body scans, CT, MRI without symptoms. Excess radiation and unnecessary fear colon cancer screening. So let's begin with the first and most discussed checkup, colon cancer screening, especially colonoscopy. 1. What is colonoscopy and why is it done? Colonoscopy is a type of exam where a long, thin, camera-equipped tube is inserted into your colon. This allows doctors to see the inside of the colon, and if they find any polyps or abnormal tissue, they can remove them right away. It is mainly used to prevent colon cancer and detect it at an early stage. 2. Benefits of colonoscopy at age. 50 to 69 colon cancer usually develops slowly. At this age, screening often detects polyps early. With timely treatment, the chances of saving lives are very high. That's why in the US, regular colonoscopies are generally recommended starting at age 50.3. So what's the problem after 70? Now, here's the real question. Why can colonoscopy often do more harm than good after crossing 70? The risk factors are procedural complications. Colonoscopy is relatively invasive. It carries risks such as perforation, tear in the intestine, excessive bleeding, or infection. As the body ages, tolerance decreases, so the risks rise. Effects of sedation. Colonoscopy usually requires sedation or anesthesia. After 70, many seniors have heart, lung, or kidney problems, which makes sedation more dangerous. Limited treatment options if cancer is found. Even if colon cancer is detected after 70, surgery or chemotherapy is often not feasible. So the overall benefit of the test is reduced. Burdensome preparation. Before a colonoscopy, patients need to follow a liquid diet and take strong laxatives. For older adults, this is difficult and may cause dehydration or electrolyte imbalance. 4. What do medical guidelines say? According to the American Cancer Society and the U.S. Preventive Services Task Force USPSTF, colonoscopy is generally recommended up to age 75. After 75, routine colonoscopies are no longer needed unless specific symptoms appear. After 85, colonoscopies are strongly discouraged. 5. What should you do instead? Advice. If you're over 70 and have no abnormal findings in previous tests, it's best not to start new colonoscopies instead. Doctors often recommend lower risk tests such as the FIT test, fecal immunochemical test, or stool DNA test. These are non-invasive and can be done at home. However, if you notice sudden bleeding, unusual abdominal pain, or unexplained weight loss, you must consult your doctor. Part 3. Prostate cancer screening. Now let's move to the second important topic, prostate cancer screening, also known as the PSA test. Many senior men get this test, but after 70, the results are not always in their favor. 1. What is the PSA test? PSA stands for prostate-specific antigen. It's a blood test that measures the level of a protein produced by the prostate gland in men. If PSA levels are high, doctors may suspect prostate cancer, but elevated PSA doesn't always mean cancer. Sometimes it's caused by prostate enlargement or prostatitis opening parenthesis, Infection closing parenthesis dot 2. Benefits of PSA. Test at age 50 to 69. If prostate cancer is detected at this age, treatment can be life-saving. In many cases, the PSA test helps detect cancer at an early stage. 3. So, what's the problem after 70? The main risks are overdiagnosis after 70. Very slow-growing or non-progressive prostate cancers are often detected cancers that would never have caused real health problems. But because of the test, unnecessary fear is created. Overtreatment. Once cancer is detected, doctors usually suggest surgery, radiation, or hormone therapy. But for men over 70, these treatments often reduce quality of life, urinary incontinence, loss of sexual function long-term. Fatigue. False results from PSA. PSA tests often give false positives, meaning the report suggests cancer, but in reality, there isn't any. This leads to unnecessary biopsies or surgeries. 4. What do medical guidelines say? According to the American Urological Association, AWA, and the USPSTF, PSA screening is generally not recommended after age 70, because in this age group, slow-growing prostate cancer usually doesn't affect overall lifespan. Instead, the test often leads to unnecessary treatment. 5. What are the alternatives? After 70, instead of routine PSA testing, doctors usually follow a symptom-based approach. That means testing only when there are warning signs such as difficulty urinating blood in urine, unexplained bone pain sometimes. Doctors use an approach called watchful waiting or active surveillance. This means even if cancer is detected, they don't start immediate treatment but monitor the patient closely. Part 4. Mammogram. Now let's talk about the third important screening, mammogram, the well-known test for breast cancer. For women, this is one of the most common checkups. But after age 70, its necessity is debated among doctors. 1. What is a mammogram? A mammogram is a special X-ray test that examines breast tissue. It is mainly used to detect breast cancer early. In the US, women ages 40 to 70 are generally advised to have regular mammograms. 2. Benefits of mammogram at age 50 to 69. If cancer is detected at this age, treatment can improve longevity. When a tumor is caught early, surgery or radiation can often save lives. 3. So, what's the problem after 70? The risks are overdiagnosis after 70. Mammograms often detect very small or slow-growing cancers that would never have caused harm in a woman's remaining lifetime. But once detected, they lead to unnecessary treatment, overtreatment. Once cancer is diagnosed, doctors usually recommend surgery, chemotherapy, or radiation. At 70 plus, these treatments often weaken the body, cause long-term pain and fatigue, reduce quality of life. False positives. Mammograms sometimes give incorrect results, suggesting cancer when none exist. This creates unnecessary biopsies and mental stress. Asterisk 4. What do medical guidelines say? According to the U.S. Preventive Services Task Force, USPSTF, mammograms are recommended up to age 74. Beyond that, routine screening is not advised unless there are special risk factors or symptoms. The American Cancer Society gives similar advice after 70. The benefit of routine mammograms is very limited. 5. What are the alternatives? For women over 70, the most important step is paying attention to bodily changes. If you notice a new lump in the breast, unusual swelling, nipple discharge, or bleeding, then you should see a doctor immediately. Otherwise, skipping routine mammograms and following a symptom-based approach is safer. Part 5. Cervical cancer screening. Next, let's move on to the fourth checkup, cervical cancer screening, also known as the Pap smear test. Many senior women wonder whether it's still necessary after 70. 1. What is a Pap smear test? A Pap smear is a test where a doctor collects cells from the cervix, the opening of the uterus. These cells are examined under a microscope for abnormalities or early signs of cancer. It helps detect cervical cancer early. Typically, women ages 21 to 65 are advised to have regular Pap smears. Asterisk. 2. Benefits of Pap smear at age 3065. The risk of cervical cancer from HPV, human papillomavirus, is higher in this age group, Regular Pap smears catch cancer early, making treatment more successful. 3. So, what's the problem after 70? The reasons are lower risk after 70. The chance of developing new cervical cancer is very low, especially if past Pap smears have been normal. Extra stress. At this age, the test can be physically and emotionally stressful. Unnecessary treatment. Sometimes minor abnormalities show up in reports that would never have turned into cancer. But these findings can lead to unnecessary biopsies or surgery. Point 4. What do medical guidelines say? According to the American Cancer Society, ACTS, and the USPSTF, if a woman has had 2 to 3 consecutive normal Pap smears after age 65, she doesn't need Pap smears after 70. Only women with special risks, such as past cancer, weakened immune system, or HIV infection, need to continue testing. 5. What are the alternatives? Asterisk after 70, instead of Pap smears, women should focus on overall health monitoring. For example, unusual pelvic pain, vaginal bleeding, unexplained weight loss if these symptoms appear. It's important to see a doctor right away. Part 6. Routine whole body scans. Finally, let's talk about today's last and most important topic: routine whole body scans. Many people think that doing a CT or MRI every year will catch all diseases early. But the truth is, after 70, this habit may actually cause more harm than good. Part 6. Routine whole body scans. Now let's move on to today's final and most important topic: routine whole body scans. Many people think that doing a CT or MRI once a year will catch every possible disease early. But in reality, after age 70, this habit can often cause more harm than good. 1. What is a whole body scan? A whole body scan usually refers to CT scan, computed tomography, MRI scan, magnetic resonance imaging. These tests create detailed images of the inside of the body, often done without any specific symptoms. They are usually marketed as a way to find hidden cancers, tumors, or other health problems. 2. Why do people want them? Many seniors believe, if I scan my whole body once, everything hidden will be found. TV commercials, health clinic promotions, and flashy offers often make these tests sound attractive. Some people do them for peace of mind. 3. So, what's the problem? The risks are radiation exposure. CT scans expose you to high levels of radiation. After 70, the body's cells are less resilient, and unnecessary radiation can actually increase the risk of developing cancer. False. Positives. Scans often pick up tiny spots or shadows that aren't harmful. But once doctors see them in a report, they may recommend a biopsy, surgery, or further testing, all of which may be unnecessary, costly, and stressful. Whole body scans are very expensive. Medicare and insurance don't always cover them. On top of that, abnormal findings can cause anxiety and emotional stress. Incidental findings. In medical terms, this is called an incidentaloma. That means something unexpected shows up that never needed treatment in the first place, but once discovered, it leads to worry, follow-up tests, and sometimes even unnecessary procedures. 4. What do medical guidelines say? Both the American College of Radiology and the FDA clearly state, routine whole-body CT or MRI should not be done without symptoms. These tests should only be performed when a doctor suspects a specific problem. 5. What are the alternatives? Instead of doing unnecessary CT or MRI scans after 70, it's better to focus on regular physical checkups, blood tests, symptom-based testing. If you notice any unusual changes in your body, then and only then should you get a scan. Part 7. Conclusion plus ending touch. So friends, today we took an in-depth look at which health checkups may cause more harm than good after age 70. The 5 screenings we covered are colonoscopy. After 70, the risks are higher, so it should only be done if there are special symptoms. PSA test, prostate cancer screening. Overdiagnosis and asterisk overtreatment risks make it unnecessary after 70. Mammogram after 70. Routine screening has very limited benefits. Pap smear cervical cancer screening. If previous reports were normal, there's no need after 70. Whole body scans, CT MRI without symptoms lead to unnecessary radiation, cost, and anxiety, so they should be avoided. Final advice with a positive note: as we grow older, our focus should shift to keeping life simple. Instead of unnecessary tests, let's pay attention to eating healthy, doing light regular exercise, getting enough sleep, and maintaining peace of mind. The most important thing is to listen to your body. If you notice any unusual changes, consult your doctor right away. Remember, after 70, it's not about more tests. It's about smart care. Closing line: if you found today's video helpful, don't forget to like, share, and subscribe to our Seniors Healthy Tips channel. Wishing you all a healthy, long, and joyful life. That's all for today. See you again with another important health topic. Until then, stay healthy, stay aware. Thank you for watching.